Thank you very much, Kimberly. So my talk is kind of all the things that I sit down and speak with each of my patients. So it's going to overlap with a lot of the talks that you've had. And I'm also going to talk about 3 new prospective studies that I'm launching. So if you're interested in getting involved, I'd like your information. So as you've heard and as you know, it's a long journey. And the natural history can be very, very long. I just had a patient the other day. She's in her 5th year of active disease. And she's going back and forth between smoking and not smoking, and depressed and tearful. I mean, it's just heart-wrenching being a provider. And I feel very lucky to know people, as I see in the audience, who've made it to the other side of the journey. Because it can be really difficult on families, on the patient, of course, on keeping your job, all that sort of thing. So the focus of this lecture is to give you some tips while you're in that journey. You might not be ready for surgery, but what are things you can do every day to try to make your journey shorter and less difficult? So these are going to be my top 10 favorites. So stop smoking. What are the dietary considerations? I heard somebody ask about thyroid tests. I have strong views of what you need to do. How to optimize your eyes' comfort. Intranasal steroid use, which many of you may be on for other reasons, that you can use it actually for your eyes. Hair loss treatments, because even though I'm an ophthalmologist, eyelashes, eyebrows do disappear in addition to the hair, so I've gotten interested in what we can do about that. And then all the different rejuvenation and repairs. Anyone in this room still smoke? Okay. No one will admit it. So my patient the other day, as I said, she was on her 5th year of activity, and I said to her, "Why did you start smoking?" And she said, "Well, I went off it for 2 years, and I just figured I'm done. It didn't work. I haven't gotten better." Well, the problem is that we know that nicotine not only is a direct stimulant of the autoimmunity process, so it interfaces with your T cells and B cells that Terry Smith and others have spoken to you about, but it actually interfaces with iodine, so it's double bad. So the tobacco is bad if you had arthritis, the tobacco is bad if you had any other kind of inflammation, but the tobacco is double bad if you have thyroid disease of any kind. And so this patient, I had to explain to her, we can't do another round of IV steroids. We can't do anything because your smoking is going to interface and make all my treatments worthless. So if anyone smokes, please take on another vice. I joked with her, I said, get a marijuana card. No one's ever shown that there's a problem with marijuana. It's specifically smoking tobacco. It's going to make you more likely to lose your vision, and it's going to especially make you look like this, feel like this, angry, swollen, and frustrated much, much longer. Normalize your thyroid levels. I personally have had thyroid disease. I personally have had thyroid eye disease. It's now been since 1997, so I remember what it felt like to be hyper. And there's nothing worse than being hyper and then being on steroids. So when your energy and your thought process, you kind of end up what I call the fog of thyroid eye disease. So normalizing your thyroid levels is extremely important for your entire body, for your hair, for your skin, for your mind, for your emotions. And so when I interface with endocrinologists who don't understand that doing this is a bad thing for you, I get very frustrated. How many people have been on methimazole greater than a year? Okay, you need to address that. So methimazole, if methimazole is going to work, it should work within 12 to 18 months. If you're finding that you're continuing to be on it and it's not working for you, you need to redress that with your endocrinologist, because you don't want to have the fluctuation, not only for the eyes, but just as a whole being. You're not going to get through your brain fog and all the irritability and that sort of thing if you're flip-flopping or you're staying particularly low. There's a test that's very important for your practitioner to test. It's called the Thyroid Stimulating Immunoglobulin. At one point, it wasn't available widely. This was about a decade ago. Now it's available everywhere. If you get your care in the VA, it's called the Thyroid Index. If you get it in any other lab, it's called the TSI. And this, if you picture that your thyroid and your eyes are communicating by these little circulating things in your blood, those immune complexes are what this test helps us understand. So you want to see those go down. And it typically does follow or at least mimic what's going on. When you first become active, sometimes you get your tests taken and your doctor says, well, you don't have a thyroid problem. All your tests are fine. Have them test this. The TSI often is abnormal in patients who are theoretically euthyroid. The TSI is also very helpful for me to decide how aggressive to be with someone. How, am I going to put them on IV steroids? Am I going to push them to have other, like rituximab or other interventions? So if somebody's a male and a smoker and their TSI is 800 or 900, that's all the bad risk factors for horrible things happening that will create a long-term disability. So it helps guide me, helps me guide you. Moisturize your eyes. So I'm going to be talking about an innovative tear product that's now stimulates your meibomian glands. So the glands in your eyelids are called meibomian glands. Big word, just means they're what give you the oil that stabilizes your tear film. Just like all the other structures in your eye, your eyelid gets more open, that your fat expands, that your muscles get bigger, but your meibomian gland actually has a number of different proteins that interface with it, and it is also altered in thyroid eye disease. So moisturizing specifically with no preservatives in your tear product. When you're looking at the tear products, it's become extremely confusing. It's, you go there and it says many shampoo, the shampoo section's this big and the, toothpaste section's this big and the eye section's now huge. What you're looking for is no preservatives and something that's oil-based. So anything that says that it's going to increase the oil component of your tears is going to be your best tear product. Warm compresses. Why would warm compresses work in thyroid eye disease? Warm compresses work because when you put warm compress against your eyelid, it makes your meibomian glands secrete more oil, which makes your tears stick around longer and makes your eyes more comfortable. So very helpful, and I'll be showing you a mask you can use that comes with a little thermal device that you can actually go to sleep with it on. You want to wear protective eyewear. So if you're out and about, you want to make sure you've got the good big glasses. You want to wear a hat. You want to protect from the stimulant of the environment. And then tinted lenses are very helpful. The same tinted lenses that are used for blepharospasm are extremely useful. They're kind of like a pink tint, so they look a little different, but they can make your eyes much more comfortable. At night, if your eyelids open even a little bit, ask your partner or your friend to look. My eyelids still open at night. And so when I'm in very dry environments, I use the saran wrap technique that actually a patient told me about, is you put the ointment in your eye and then you just cut the saran wrap, any of the plastic wrap, so it's about this big, and it actually will just stick. You don't need tape, you don't need anything else. Or you can use, in addition to that, this Tranquilize. So this product was created by somebody who's not an optometrist, not an ophthalmologist, not a thyroid patient. It's a person who actually had dry eyes. And these are very comfortable. And they come with little inserts that you push on them and they become hot. So it can be used as a warm compress to stimulate your meibomian glands to secrete that oil that's so important for your comfort. You want it, as far as what things ideally, there's all these dietary things out there. What we know for absolute certain is if you have high salt or high MSG in the evening, not only will you swell and look more puffy, but you're going to have dysfunction. So if you're having problems with double vision or you're having problems with a lot of periorbital edema, take a look at what you're eating at night. MSG is in so many different products now, and we know that it's going to attract that edema that's going to give you all the problems with either the disfigurement or the disability. Selenium. Selenium is one of those herbals that's out there, and it apparently is going to make you do better. So when I first heard this, I was like, oh, I don't know. But there was a nice prospective study, and the patients were randomly assigned, and it was found that by taking the 100 micrograms of the selenium, patients actually had an improved quality of life. Patients had slowed progression, reduced eye symptoms, and no side effects were reported. So it's one of those things that's an over-the-counter medication that you can use when you're in the active phase, when your doctor's saying, nope, we can't do surgery yet, nope, we gotta watch and wait. You can consider using this. Vitamin D. Vitamin D should be really referred to as hormone D, because D is so important, and we now know the more that we're wearing sunblock and protecting ourselves so we don't get skin cancer, we're actually doubling our cancer risk. But also, it's a mood stabilizer. So if you are having your testing done, you're getting your TSH and your usual labs, now you know to ask for the TSI. Make sure you know what your vitamin D level is, because there's not a whole lot I can do for the dysphoric mood of somebody who has thyroid eye disease, but I can correct their vitamin D, and that will make them feel much more stable. So that whole thing of, when you're out in the sun, you feel better, it's true. It actually does help you liberate things that make you feel better. Sources for vitamin D, definitely sunlight. So the risk of melanoma is not as important as the risk of dysphoria and for instance, colon cancers and other cancers. So you do want to get some exposure to sunlight, not sunburns. You do want to consider taking an omega-3, omega-6, and you can do that with flaxseed, fish oil. There's a number of things. So as far as supplements, you've got the selenium to think about, the vitamin D to think about, and then you want to consider taking also the arnica that was mentioned by the prior lecturer. There's now Arnica masks that we're going to be testing to see whether a topical product could help people who need to look good for their work or just their life the next morning. But the key thing is some people will go to the counter and not know what to grab. You want D3, not D2. So, and all these notes are in your handbook. So what's the right dose for you? Well, you know, I know a lot of my patients, they have an endocrinologist and they maybe have an eye specialist, but a lot of times don't have a primary care doctor. You need to be talking to somebody about your dosing and your vitamin D and your selenium and that sort of thing. So I'd really recommend that you have a really good relationship either with an endocrinologist, which sometimes is difficult because there's so few of them, or you need to get a primary care doctor who looks at you as your whole self and makes sure that you're nutritionally supplemented. There's a goal of where it should be, and you do need some testing. And so this isn't something that you should just self-treat. You really do want to work with a health professional. Corticosteroids. Well, I'm sure lecturers have mentioned this, and I would bet most of you have heard that prednisone and other topicals have been used. I actually like intranasal steroids. And you'd say intranasal. Well, intranasal, think about the relationship of your orbit, which is the area of the eyeball sits in, and your nose. So when you go up your nose, you are actually going straight towards the orbit. And that orbit, that wall, that medial wall that was discussed by the prior lecturer, that's very, very thin. And actually in a lot of thyroid patients, there's little cracks in it. When we go in surgically, you can see them because that muscle, every time you move, is kind of hitting against it. So there's little cracks. In addition, there's two vessels, very large foramen that sit right there, the anterior and posterior ethmoid foramen. So when you're putting the nasal spray up your nose, you're actually delivering it to the orbit. And we know that patients, for instance, whose pressure in their eye goes up in response to steroids will get that same elevation from going intranasal. Why intranasal? Well, we've talked about preservatives are bad for you. So if you're putting a topical drop on your eye that's got a preservative, oftentimes the goodness of the steroid is off-put by the badness of the preservative. So this is, again, something where I was listening to my patients talk about it, and I was like, this is very interesting. And this Nasonex specifically is the best one because of its high potency and because it loves fat. So what's behind your eyeball? Fat. 4 tablespoons, maybe 5 tablespoons of fat, just wanting to suck this Nasonex behind your eye and calm the eye and make you more comfortable. It's very safe, unlike oral prednisone that has issues with your cortisol, has issues with growth retardation in children and bone issues in all of us. This doesn't. It has a first pass where it doesn't get systemic. So it's got the benefit of not irritating your eyes and also the benefit of not traumatizing your already traumatized body. There are some side effects. The most common is if you go to altitude, for instance, take a flight from here to New York. When you go to blow your nose, you may notice there's a little bit of blood in it, but it's not the kind of thing where you'd have a massive nosebleed. The other things are extremely unusual. Cataract formation and increased intraocular pressure do occur because, as I said, it's being sucked into the fat that sits behind your eyeball. The instructions for this are absolutely crucial. You need to think about, okay, you've got this bone, and the bone needs to be clean. So you take your nasal spray, and you just take normal nasal spray, and you just give a little rinse, then you gently blow your nose, then you put your Nasonex in. If you picture there's a septum that divides the nose, you want to direct it slightly in this direction because you want to think you're going towards your orbit. You obviously don't want to then spray anything else in your nose because just like when you put an eye drop in, you don't want to follow it with another eye drop quickly, you're going to wash it out. But Nasonex is something you should ask your practitioners about. You've heard an elegant description of all the different things that you can use. The surgery is certainly an option. When we talk about the order that people should have surgery, that's the order that we've talked about for decades. So I've been in practice for 25 years, and that was the dogma. You're not a dogma, you're a person. So it's oftentimes a patient will come to me where somebody has refused to do their eyelid retraction surgery or interface with them because they say, you really have to get more stable because you need to have your decompression done first. That's not the case. Sometimes eyelid retraction repair can make you dramatically more comfortable, make you more functional, get you feeling better and feeling like you can work and interface with the public well in advance of you becoming completely stabilized. This is a typical patient. We all recognize this, and there are times where the cornea is just not happy. It's starting to break down. You can see there's a yellow spot where it's no longer has its epithelium. This patient, it doesn't matter that they're in the active phase. They need something, and they need something now. So the options are to use Botox. Botox is extremely effective at relieving eyelid retraction in patients with active thyroid eye disease. Botox will not activate your disease. It's a tiny prick. It looks scary, but it's remarkably effective. The downside is it will only last up to 6 months. Something that's more lasting, and that's what you had seen used both for cosmetic reasons and for medical reasons, is the filler can be used in addition to the Botox. So you can do the Botox, come back 2 weeks later, do the filler. This can be billed to your insurance. And there are codes that can be used so that you don't have to pay for this. The problem with Botox alone is that Botox only works, as I said, 3 to 6 months. The problem with filler alone is to get enough filler to drop your eyelid, you're then going to have issues with puffiness. Because what happens in your fat from thyroid eye disease is something called hyaluronic acid accumulates, and that's why we get the puffiness. So if I'm adding too much hyaluronic acid, you're going to end up having more puffiness than you want. So really the best is to combine the two. So Botox and then 2 weeks later, the Restylane. I really prefer Restylane. I think that Juvederm, which is made by Allergan, that you see in a lot of the women's magazines, it pulls too much fluid and it's going to make you too puffy. So again, it would be Botox first and then 2 weeks later, Restylane. As far as the upper eyelid surgery, there's a number of different minimally invasive things that can be done again in your active phase. This, you can have your muscle debulked, you can have your muscle weakened. If I do it in someone who is in the active phase, I am going to be taking certain precautions. I'm going to be treating you with IV steroids. I'm going to be injecting you with steroids at the time of surgery. But again, you don't have to wait, especially these patients who've been active, a year, 2 years, 3 years. You don't have to wait to have your surgical intervention. There are ways to manipulate your hormones. In some cases, you have to do a through and through incision. This is actually the least traumatic. So in the most active patient, this is going to be the surgery I'm going to do because it's just literally it takes me 1 minute. I just make an incision and you're done. And I augment that typically with Botox and also the fillers and can get you very comfortable. As far as the different options that were discussed, I'm a big fan of tarsal transplant using your own tissue. The hard palate that somebody had asked, do you need an oral surgeon in with you? The hard palate can be taken by an oculoplastic surgeon or you can have an oral surgeon. This is extremely painful. I would not recommend this. If your surgeon's pushing you in this direction, ask for other options. As far as the other things that were mentioned, the synthetics are bad. Your body doesn't like synthetics. It's going to increase your autoimmunity. So you want to really use your own tissue if you're in the active phase. That's why that tarsal transplant or just the tarsal split is the best. Now, as far as the other things that you can do, a lot of my male colleagues don't believe that topicals work. And so they'll tell patients, maybe Retin-A or describe that they should use sunblock. But we know that vitamin C is what blocks DNA damage. And we know that as a person with thyroid disease, your skin is altered. Your collagen is altered. That's why if you take a picture of somebody before thyroid disease and after thyroid disease, their pores are larger. They have more fine lines and wrinkles. They have more descent and unusual fat deposition because your collagen is being affected. So if you said, I'm in the active phase, what one product should I integrate to my face? I would say vitamin C. And there are a number of different versions of it. You want at least 20%. And you can only get this in a dermatologist's office or an oculoplastic person's office that has these kind of products. If you go to the store, you got, again, just like the shampoos and the eye products, I mean, the skin stuff's out of this world. The problem is twofold. One, it has paraben in it. Paraben is an artificial preservative that keeps it a shelf life of like 5 or 10 years. That's why all these companies love it. It's actually outlawed in Europe for many years now because it's bad. What does it do? It's linked to cancer, but it's definitely linked to autoimmunity. So you should never put a product on your face with paraben. You should look at a doctor's office, find a paraben-free vitamin C source, and integrate that into your regimen. As far as the other things, micronized zinc, there's a zinc brush, there's Color Science, there's Jane Iredale. Again, you're gonna have the DNA damage that you can't do anything about because it's part of your autoimmunity, but if you protect your face from the sun and additional DNA damage, it'll minimize how much sagging and changes you have. What's the liquid facelift? Well, it was discussed, a little briefly. This, unfortunately, no matter what we do, Medicare and all the insurers that follow Medicare don't understand that your disease has given you a markedly different look. You are, at this point, blepharoplasty, which is eyelid lift, and fat removal in that blepharoplasty are approved by Medicare and should be done medically. You shouldn't be paying cosmetic fees. But as far as getting the Botox and fillers to get rid of, a line that makes you look angry, we still have not reached that at this point. Hopefully, there'll be ongoing lobbies, and maybe in the next couple of years we can get that done. Now, removing the skin, this is not something you want to do in the active phase. So let's review. You can do all the different nutritional things. You can do the warm compresses. You can do the moisturizing. You can even do eyelid retraction surgery. But do not have anybody touch your fat, because your fat is a very immunologically active thing when you're in the active phase, and you can just explode. It could take you from being, active but not that bad to really, really severely puffy, red, swollen, and painful. So this really has got to be done in the chronic phase. This is an example of a patient sent to me, and no, she does have eyes. She's looking up. She can't close her eyes. Why can't she close her eyes? Well, first of all, there was too much skin removed. But the other thing is this was done by a general plastic surgeon who removed the muscle that lets her close her eye. So they have to remove the muscle, and now she can't close it. And there's no way to transplant the muscle. I can transplant the skin, but you got to be very wary. Don't let anybody but an oculoplastic surgeon touch your eyes. I know you got all this board-certified plastic surgeon. They're really general surgeons who get very little exposure to eye surgery, and they know nothing about thyroid eye disease. So just beware when you do decide to have your oculoplasty, have a blepharoplasty, that you go to somebody who knows what they're doing. You can have really nice results. I tell people I can get you back to about 80% of, maybe 90% of where you were before, but I can never get you that last 10%. So there is going to always be some difference. So when I ask a patient, why are you upset? And they tell me, I'm looking in my mirror, and I say, and what's your mirror look like? And they say it's a 5X mirror. I tell them, put down the 5X mirror, it's bad for your soul. It is. No one should be looking at their eyes who's over the age of 30, never mind has thyroid disease, in a magnifying mirror. Just put it down. No one sees you 5X. I see you 1/8X. So just be careful. Finally, there's the other thing you can consider, and again, this is in the very, very chronic phase to help you with the skin changes that are a result of the Graves' disease or the hypothyroidism, is laser resurfacing. Laser resurfacing can take your skin that is remaining after the skin is removed, as much can be removed, and the fat repositioned as much as it can be repositioned. And this will then help with the pore size, the fine lines, the ruddiness that's so characteristic of Graves' disease. So it's a nice option, but again, it's something that's at the very end of the road. And I usually reserve it for after the blepharoplasty, and do it usually 2 to 3 weeks after the blepharoplasty. So hair loss treatment. So one of the most, I see men in the audience, and you guys, you're going to say, what? Well, men lose their hair, and in society, men who are completely bald or balding are revered as knowledgeable. That they look like they know, they have sort of that Marcus Welby effect, I say, in medicine. We women, we're not supposed to lose our hair. So there's probably nothing more alarming than brushing your hair and taking a look at the brush and going, or touching your hair and having whole clumps of it come out. And I think that this is one of the things we just don't get talked to enough. And so One of the things you want to do is you want to make sure your thyroid levels are as normal as possible. So that requires frequent monitoring. And you want to think about, again, there's different supplements that can help you. And there's an interesting product out there. Nioxin has been around for a long time, but Kerastase just came out with one. Vita has one. And these seem to stabilize as much as you can by just, they moisturize and stabilize the follicle. Is it going to reverse it? No. Is it going to maybe help you as you're going through your active phase where the hair is falling out? It can help. So what I would say is when your endocrinologist or your oculoplastic surgeon says there's nothing you can do about your hair loss, they're wrong. You need to pursue seeing a person, and this is go to your cosmetologist, have them look at your hair and have them make recommendations. As far as other things, do not do hair extensions. They're just going to pull your hair out. Do wigs if it gets bad enough, but don't do hair extensions. If you're somebody who colors their hair, be careful. Go make sure that you go. There's now organic coloring and straightening that you can do. So again, beware of who's touching your hair because they can make your hair loss much, much worse. I get asked a lot about eyebrows and eyelashes because some people suffer with lateral brow loss or they suffer with central eyelash loss. Latisse is the only FDA-approved medication for hair loss of the eyelashes or eyebrows. That said, Latisse is simply a glaucoma drop that got put in a new bottle. Latisse is too expensive, and Latisse is the exact same thing as all the other things on the internet. Revitalash, Lilash, they're all the same, they're less expensive, and they're just as effective. So don't go waste your money on Latisse. Latisse also had a very bad packaging decision. To get FDA approval, they had to come up with brushes that you use each day on your eye. The brushes are coarse. They will cause your thyroid eye disease to become more active. They'll give you redness, bruising even. So if you're going to use Latisse or get your ophthalmologist to just give you Lumigan, you just put it on a normal eyeliner and you can put it just where you'd wear your eyeliner. For men with thyroid eye disease, their most common thing is, and it also has to do with loss of testosterone, is they can lose their eyebrows. As they start having an eyebrow that's only central, this exact same thing can be put laterally on your eyebrow and it'll grow it back. Again, the price point, Lilash, you can get for $49 to $75, whereas Latisse, $199. It's the exact same thing, equally safe. So new stuff. So here's my new topics, and if anybody wants to move forward with using any of these, I'm going to be testing each of these. So Lotemax Drops and Ointment came out. Lotemax is the first preservative-free. It's low-to-prenolol, so it's less likely to cause increased pressure in your eye. But it's preservative-free, and it seems to be helping thyroid patients by using it at night. Up until now, we'd had no preservative-free ointments available that were a prednisone. Now the Lotemax drops have some preservative in them, so I'm skeptical that they're going to be any more effective than Pred Forte or any of the other drops. But I do think asking your health practitioner for a trial of the Lotemax ointment would make sense. It's very pricey. It is covered by Medicare. It is covered by some insurers, but ask your oculoplastic surgeon to contact the rep, and they'll bring in a whole bunch of samples, and they can give it to you for free. Arnica Forte mask, Arnica Montana was discussed in the last lecture. Arnica definitely works. It stops bruising, but it also stops swelling. And I've had a number of patients who just take Arnica every day to help with the puffiness, but there's a new mask out. So here's a Lotemax. So Lotemax, as I said, the ointment is the preservative-free, and that's the one that I would recommend. There are a number of Arnica masks out now where you would sleep in them, which makes sense if you're an active professional and you need to be looking good for your 9 a.m. meeting, that you could potentially use this either on days where you have something big going on the next day, or even potentially each night if you can afford the product. Arnica has a mechanism of action that no one really understands, but it does combat inflammation, specifically edema associated with that hyaluron where it's pulling the fluid. This is the tear product I was telling you about. So there's a new Tear Science has come out with LipiFlow, and the LipiFlow is looking at the oil in the tear. So if you look at the top, you can see you can see the tears, but in the bottom it almost looks like there's an oil slick. The bottom is the normal one. The top is probably everybody sitting in this room. The oil is what makes us comfortable. those meibomian glands are being altered by your thyroid eye disease just as much as your extraocular muscles. And so you look like the top. And so that's why when the wind blows or you feel like you're light sensitive, it's because your cornea is not being covered like it should be. So what's interesting is they've got this new device that's called LipiFlow. And I make it akin to kind of a curling iron. So I had it done on my left eye the other day. It doesn't hurt. It's like, but they put part of it on your eye like you would a contact lens, and then the other part kind of massages your eyelid, and you feel a little bit of warmth. It takes 12 minutes. They do both eyes at the same time. And what it does is it increases your meibomian gland function by kind of, I make the analogy, it's sort of like taking a garbage disposal, and you just get, the sink empties immediately. This just gets rid of what's there. And then the new stuff that comes is just going to be able to get through what used to be a clogged sink. So interesting, new innovative LipiFlow. So in summary, I hope I've given you some little tips. My email is my name, so it's cockerhammd@gmail. I'm happy to do virtual visits. You can send me your picture. You can send me your question. If you, this will actually be put up on the website, so if you have, if you can't remember what was that LIPA thing, I'll be doing that. If anybody is interested in getting involved in any prospective studies with any of those three things we talked about, the mask, the ointment, or the LipiFlow, do contact me and let me know. Thanks so much. So I have time to take questions. Any questions? Has anybody been told that they have meibomian gland dysfunction? Has anybody even ever looked at your meibomian glands? Okay, we're going to have to start that.
I have a question about the TSI test, because that seems to be the cause of a lot of confusion. Sometimes we hear from people that say, my TSI level was 70, and so my doctor says I don't have Graves. And we'll never contradict somebody's doctor, but isn't that indicative that there's something going on?
Right, so the TSI is helpful if it's abnormal. The TSI is not helpful if it's normal. So you can have raging disease and all your labs are normal. So the TSI is not perfect. It's like the TSH. So I started having my hair fall out, 9 months before any lab was abnormal. And because I was involved in taking care of Graves' patients, I was like, I know what this is. But so as you know, it can lag, and so the TSI is imperfect. But if the TSI is elevated, it is very indicative of thyroid eye disease. So what's hard is, you go to a practitioner, you've got eyelid puffiness, you've got redness, you've got chemosis, you've got an ache, you've got diplopia in the morning, and your TSI is 600, and someone looks at you and goes, you don't have Graves, I don't believe in that test. You need to pick another practitioner. Because thyroid eye disease is a diagnosis that requires no lab abnormality. And so what I would say is the TSI, it's helpful, and it can help me understand whether I'm going to counsel you. Yes, you should get into the new IV steroid protocol that's much less invasive than you taking prednisone, because your TSI is really high and you've got these risk factors. So in answer, it's an important test. It's not a perfect test, and you should go to a practitioner who understands the test. Anybody else? Yeah.
In the beginning, you said there was a product for eyes that you could sleep with overnight.
Mm-hmm.
Which one was that?
That's the Eyecho Mask.
Okay.
Yep. So what I'd recommend if you go to eyecho.com, it costs about $75 plus tax. And get Lotemax given to you or prescribed to you. Put the Lotemax in your eye. If you're really dry or your eyes really don't close very well, you could put the Saran wrap on top of the ointment. And then you put the Eyecho Mask, and it feels really good. It's like, if anybody skis, those things you put in your gloves that stay warm, it's like that. You push on it, and then it just keeps it nice and warm, kind of soothes you to go to sleep. And it comes in leopard and zebra. No, they do. They really do. So they have like the standard pink and blue, and then they have little things you can put over them if you want to have, different look. Yeah.
Is the LipiFlow experimental, or is it available?
LipiFlow is FDA approved, and if you Google the device, you can find who has it in your state. But yep, it's Tier Science is a company that got it approved.
And is it sort of permanent?
It lasts for anywhere from 12 to 18 months.
I'm going to see if we can slide this over just a tad, and then I'll pull up the
absolutely.
next presentation.
Do you want me to? I guess I can just leave that till the break.
Okay.
Yeah.
Oh, no, if you can,
Oh.
I can let you keep the mic there.
Any other questions? Yes.
Is the Arnica oral or topical?
Both. So I would highly recommend not Arnica Montana that you get at Whole Foods, because it can give you diarrhea or a stomach upset because you have to take so much of it. The better stuff is called Arnica Forte. It's available through, again, your doctor's office can do it. There's that Arnica Forte also has a little roller that you can use, and then now there's the masks. And the masks, there are two main companies that are competing in the space, but those are all just complementary. Yes?
Does the TSI have any relevance in the inactive phase? What would you anticipate the TSI being after you're through having thyroiditis?
Most people go back to normal. So most people go back under 100. That said, I do have patients where they're, I've been following them for several years now. They're absolutely in the chronic phase. They have no fluctuation whatsoever, and they're hovering at 275 or 300. And I tell them, don't worry about it. It's sort of like the mirror. Put down the mirror. Stop testing the TSI.
One of your slides had evening primrose on it.
I'm sorry, beg pardon?
One of the slides had evening primrose.
Mm-hmm.
What companies do you recommend?
So that is actually something that you'd work with your cosmetologist. So that's to help combat the hair loss. There are topicals, and there are orals, and there are essential oils that you can do. We know that the hair follicles don't like to get dry. We know that the hair follicles love stimulation. So scalp massage actually is really good in anyone who's losing their hair. And now a number of, whether it's Aveeno or Aveda, sorry, any of the organic ones I would prefer, because I'd like you not to have paraben or any of the silicones when you're doing your massage. Good?
All right, thank you.
Thank you.